Hi, my name is Barbara Corona, and I am going to apologize ahead of time. I just got off a 12-hour shift and I'm a bit tired. But this is the only time I have to get this done. So here we go, guys. What is the predominant makeup of nursing population? Well, nursing is the nation's largest healthcare profession with more than 3.1 million registered nurses nationwide. RNs comprise the largest segment of professionals working in the healthcare industry. The nurse's role range from direct patient care to case management to establishing nursing practice standards, developing quality assurance procedures, and directing complex nursing care systems. With more than 4 times as many RNs in the United States as physicians, nursing delivers an extended array of healthcare services, including primary and preventative care by advanced nurse practitioners in such areas as pediatrics, family health, women's health, and gerontological care. Nursing scope also includes services by certified nurse midwives and nurse anesthetists, as well as care in cardiac, oncology, neonatal, neurological, and obstetrical gynecological nursing, and other advanced clinical specialties. According to the United States Bureau of Labor Statistics, registered nursing is the top occupation in terms of the largest job growth from 2008 to 2018. Government analysts project that more than 581,500 new RN jobs will be created through 2018. Other projections indicate that by 2025, the U.S. nursing shortage will unfortunately grow to more than 260,000 registered nurses. Even as healthcare continues to shift beyond hospitals to more community-based primary care and other outpatient sites, federal projections say that rising complexities of acute care will see demand for RNs in hospitals climb by 36% by 2020. Now, how does the RN demographics affect the patient population? Well, we already heard when I stated that there's going to be 260,000 needs for RNs. That is a lot. So that right there is already going to affect our patient care. So the Journal of BMJ Quality and Safety of May 2013, researcher Heather L. Tubbs Cooley and her colleagues observed that higher patient loads were associated with higher hospital readmission rates. The study found that when more than 4 patients were assigned to an RN in a pediatric hospital, the likelihood of hospital readmission increased significantly. This is pediatric. Can you imagine now adult? I think of friends of mine that work med-surg that have like 6 or 7 patients per nurse. There is an article in the American Journal of Infection Control, it's the August 2012 issue, where it states, research done by Dr. Jeannie Simiati and her colleagues identified a significant association between high patient-to-nurse ratios and nurse burnout with increased urinary tract and surgical site infections for the patients. In this study of Pennsylvania hospitals, the researchers found that increasing a nurse's patient load by just 1 patient was associated with higher rates of infection. The authors concluded that reducing nurse burnout can improve both the well-being of the nurse and the quality of the patient care, which is logical, guys. Let's think about it. The less patients you have, the more attention we can give to each individual patient. But if I have 7 patients, that are on antibiotics, on drips, on different types of things. One has surgery, one has MRSA, one has this. I mean, can you imagine? You're basically running around. You don't really have time to get to know your patient, meet their needs fully. You're just doing the basics, giving the medications, making sure their, blood pressure's okay, things like that. But you're really not getting to know their patient like one-to-one. So our next question is, does the demographic of the RN population impact patient care and create healthcare disparities? Of course it does. What are the 2 recommendations, ways that we can help with this in our practice? Well, in the articles that were posted, moving forward, I like what it states here. The goal of eliminating health disparities and ultimately achieving high equity will not be realized without the ongoing engagement of racial ethnic minority nurses. Enhancing workforce diversity is needed at all levels, in nursing and in all healthcare practice and research arenas. Things that we can do or they can do that are recommended are fund nurse-led efforts aimed at eliminating health disparities in academic, clinical, and community-based settings. Expand service learning activities focused on reducing health disparities and achieving health equity in nursing programs at the graduate and undergraduate levels. So being, as we're going forward or moving forward, it is critically important to provide funding as well as to create and support policies to ensure that we continue to enhance our workforce diversity and the nursing profession. I feel that the more people go into nursing will help, but honestly, hospital facilities, I feel, for example, administration, need to be reasonable. I know that they look for things like money, but honestly, we have to decrease patient load on nurses. That way we have a great outcome with patient care, and nurses don't get burned out so quick and end up quitting or going somewhere else. I think having teamwork, communication, I think this will help us in the long run. So thank you. I hope I did okay. And again, my apologies. And I wish you a good day.